Welcome to Tech Turks. Today I have Adham, the co-founder of Drugstoc. Drugstoc is a platform that provides services and supplies to pharmaceutical industry in Nigeria. Adham, welcome to Tech Turks. Thanks for coming here.
It's a pleasure.
Tell us your story. How
and why? Time for that.
Oh yeah, we'll condense it.
Sounds good. So
the elevator pitch.
Okay, so I'm born and raised in Nigeria. I come from a healthcare background. So my father was a practicing physician here for around 40 years. So I grew up in the environment of hospitals and whatnot, but I also grew up realizing that most hospitals are owned by individual owners here. And most of these owners are doctors with no business experience. So naturally, I saw my dad be a good doctor and expand his practice, but not really take his practice to where it's supposed to be or organize certain things in ways that I would appreciate from my perspective at the moment. When I came back from my studies, I started working with several hospitals in terms of standardizing their management infrastructure. And there's one thing I kept noticing across all the facilities, including my father, is that the trust in where they get their medication from was very low. Some facility went as far as answering my question of how they tell if something is good quality or fake by telling me that they look at the pack to see if it's printed properly, and that was an aha moment for me. So I actually went to Holland to do my master's in health innovation, and I met my brilliant co-founder, Dr. Chibuzo Opara. It was through those discussions that we realized that we had to solve a pretty endemic issue to our region, not just Nigeria, is how do you ensure that the healthcare provider himself has access to all the medication and supplies he needs to serve his community. So that's how we got started.
No, I mean, you make it sound so easy, but you're dealing with different stakeholders in this industry that already have a established network.
Yeah.
How were you able to really break into that? So, for example, organization has a supply that, how do you now break in or start being part of it?
That's a good question. I think because we came from the healthcare backgrounds of being healthcare provisioners, we were lucky in the sense that our startup group of 20 facilities that we worked with were all friends and people that believed in the vision of what we're trying to do. It's not to say that we got the business model right from the first time, because the initial idea was how to use technology to aggregate all these suppliers and how do you get the orders generated for them to come through. But then we slowly realized that the quality coming from these suppliers is not standardized, and they also buy their medication from sources that are not verified. And of course, the pricing wars between all suppliers was just too chaotic for you to give an organized system to a healthcare provider. So based on that start, based on the community, we felt like we built a really robust program for them. And we decided to take it from beta staging into a more full-fledged business. So we registered the business and we internalized the IT and started to deal with these pharmaceutical companies directly. I think that was the key factor in it. Now you'll ask possibly why would a pharmaceutical company listen to a small startup in Nigeria? I think it was more of our clarity of vision and the pace that we were growing at. We were able to capture the healthcare provider from a point of view that we knew where his pain was and we knew what to address.
Okay, so before you go on, sorry to interrupt.
Please.
Define your pharmaceutical when you say pharmaceutical company,
yes.
What are we talking about? Are we talking about the pharmacy in the hospital, the standalone on the high street, or is it B2B or B2C?
So there are two aspects. So we're B2B.
Okay.
Means that we supply all your pharmacies and hospitals and community pharmacies, but we don't stop there. We also supply doctors and nurses, anybody that's licensed to practice healthcare. We believe that we are already suffering from a brain drain in Africa, where a lot of our brilliant doctors and nurses and physicians are either traveling to Canada or Europe or trying to find their future out there. We don't have enough doctors and nurses and pharmacists to cover the population's needs. Therefore, we should not have a doctor that is not empowered to do his job the right way, or a pharmacy that's not able to be profitable because of supply chain issues, or render quality to their supply chain. So we supply pharmacies and hospitals, but by default, we deal with the direct manufacturer importer of the product. The idea is to create a seamless interface between the demand side and the supply side and be in between.
Let's say the owner of the business, how does it help them, keep inventory, reorder, know exactly what they have and just be in control of that information?
So I'll tell you the first thing we help them with is that for the first time in Nigeria, you have transparent pricing on a platform. It means I don't have to second guess the price of a rare drug or a drug. I can actually see as a healthcare provider what the average fair cost to me coming is. The second way we help them is by consolidating the whole counterfeit issue, that you can trust the source of where you're coming from. But we are an omni-channel platform.
I understand the pricing. On the counterfeit,
Yeah.
how are they convinced from a layman's perspective that what you're supplying to them is authentic?
Because it's track and trace. So dealing directly with the company that's importing or directly with the company that's manufacturing, not going through any third parties, coming directly through our warehouses and coming through our logistics down to them. So from that perspective, we have an end-to-end supply chain, but also we tag certain drugs to ensure that the taggability is also confirmable via our app as well.
So clearly, I mean, the platform allows you to collect a lot of data.
Absolutely.
And give you insights into what's happening in that space. And any insights that, are there any insights that, that you have come across that has surprised you or that has helped, you do more things or go into more areas that you would never have thought of?
Yeah, so we live in the age of data, but we're very wary about how we collect and how we process data. So we only collect metadata, but we work with pharmacies to enhance their product selection mix. We tell them about their trends. So most pharmacies don't even understand that they sold this pack that for that much or this or where their profit lies or whatnot. So we share the information back, but more importantly, we use data to expand the scope of what a hospital or a pharmacy holds. So if an average hospital doesn't hold certain emergency drugs, we notice. If an average pharmacy is not holding certain drugs for babies or certain things that make their service a whole more rounded, we also notice. And we also give pharmacies that have no access to buy expensive drugs and stock them the ability to say that I can get this medication for my patients because they can see the pricing and order it and it's there in 24 hours.
So that's part of your value proposition to organizations. You give them back, you take their data, you give them information and insights for them to do more.
But we use data in so many other ways. For example, our field coverage. It's important to us to cover not just people that want to buy from us, but have this accessible to every healthcare provider. So in terms of how our field reps move, how many hospitals we tag, all that is going through a BI interface that gives us an intelligence unit that sees how much coverage we have and what areas that we're supplying this type of medication to, what price point, for example, is the most common antimalarial in Ali Morsho compared to Victoria Island, and why that is, and if it's the ideal situation as well.
Adham, last question. What's the future of Drugstoc? I mean, you've started well.
Yeah.
1,200 facilities, 2,000 doctors. Yeah. What's the future?
The future is that no healthcare provider in sub-Saharan Africa should have any hindrance towards giving the service that he needs. My future and the future of Drugstoc is embedded in the fact that you should never have any issues accessing any medication you need as a healthcare provider for your patient, and you should not pay 64 times the price of the international market because we are an underserved population. We need a lot more money and a lot more infrastructure to do that. And last but not least, no drug in the circulation should be counterfeit, substandard, or illegitimate at that point. So we're tackling a three-pronged approach, and that's where our future lies, and we wake up every day with a keen determination to achieve.
Adam, thank you for coming on Tech Turks, and we'll continue the conversation offline.